Fortunate as a trainer to have Florida Chiropractics and Mela Therapeutics on my team, being able to send my clients to them and get feedback from them right away as to what's going on and how to improve the training. It's just simply improved the quality of life of all the clients because they're not missing out a day at the gym, and we're able to get them to that next level so much quicker thanks to their help. So really appreciate it.
At Florida Chiropractic and Sports Rehab Centers, we have some really unique exercise equipment. This one is the Vortex machine. It's a great machine because you can use straps at all different levels here in the machine, and you can really do every exercise in the gym with this one simple piece of equipment. This is actually an assisted pull-up machine. If we strap a belt around his waist, and the actual weights will pull him up towards the ceiling. We use it for a lot of ballistic movements for all of our athletes, whether they're weekend warriors or pro athletes. This is going to be specific for golf or any type of rotational activity or sport. The greatest thing about this machine is that not only is it a regular cable system, it actually has these bands right here, what we call accelerator bands. And so we have it on the weight stack, so when he rotates his body to the right, he's going to get resistance from the weight, but as he's coming back to the left, the bands are going to start to compress together, and that's going to get eccentric and concentric contraction while he's doing the weight. So he's going to get a full resistance going to the right and a full resistance coming back to the left. This is really important when it comes to rotational sports, because when he's swinging a club, let's say he was lefty, and he's swinging as hard as he can to the left, the ballistic swing in golf, it takes a lot of back strength to stop the rotation of his swing. So when he's coming back this way nice and slow, he's actually working the resistant or the decelerating muscles of the lower spine, the lumbar spine. So you're going to work those muscles that are really there to protect the spine and decrease injury and prevent injury. It's the same thing when the baseball player throws. There's studies that show that actually the arm actually comes out of the socket by a little bit, and it's the decelerating muscles of the shoulder which bring it back in and stabilize it. Well, these are the same muscles that we're training, whether it be golf or baseball or anything else, that are really important in preventing injury. They also will give you that extra whip or power when your agonist and antagonist muscles can work synergistically to give you some extra pop on the ball. What's also great about this machine is he only has 7.5 pounds. He may not be the strongest guy in the world, but he's certainly strong enough to pull that, and he can turn as fast as he can to the right, and there's no slack in the weight. Okay, so we have patients do explosive training here. We have Olympic runners start in blocks and explode out of their blocks. We have patients doing jump squats, all depending on what their goals are, how intense they want to be. And again, this may look like it's a powerful exercise, but it works for everyone at all ages, of all sport levels.
I needed to find that fitness I needed for riding races. I needed to become more fit than I did with just traditional lifting weights and running.
The thing that we use here at Florida Chiropractic and Sports Rehab is the stretch table that we designed. And it works great because by using these straps and these belts, it really stabilizes each joint. And so when we get a stretch, we can really isolate the muscle that we're targeting. I don't have to climb all over my patient to hold them in position, which is uncomfortable for me. It's uncomfortable for him. And so with these straps, it really allows us to get a good stretch and isolation while it's really giving him a lot of comfort and support and stability. So we can use them stretching any type of muscle. It allows us to stretch people who are 350 pounds and who are 6'6", all on our own. So this table is a unique and great way to add some flexibility and stretching into our patients.
Dr. Matthew Cooper regularly comes to Williams Island Spa to assist with the staff and work with the trainers to lecture them and teaches them how to perform proper exercises with the clients and how to prevent injury and rehab injuries with our residents and guests.
The staff here at Florida Chiropractic is certified in KMX and TPI, which are the two leading certifications in the country, and they work with all PGA golfers throughout the world and work with the best golfers in the world. So we've taken their knowledge and given it to South Florida, and we're one of the only clinics in here that does also treatment for golfers, but then takes them to the next step in golf fitness. And when we evaluate a golfer, we do three things. We first evaluate their golf swing. We're not evaluating their golf swing for technique per se and teaching them the golf swing. We're looking for physical limitations that might be causing their injury, or hindering their performance. From there, we put them on a force plate and we analyze actually, are they decelerating and accelerating in the golf swing properly, and is their weight distribution through the backswing to the downswing proper. Once we get that information, then we physically screen them out and try to take our physical screening findings to see if that is what's causing their faults that we found on the force plate and the video swing analysis. From there, we take that and it's like putting a puzzle together and build their exercise program. Initially, we're trying to clear up any of those physical limitations that we find, and then from there we also build performance enhancing exercises. So it's like killing two birds with one stone, and every golfer that goes through it notices decreases in injuries and increase in their performance.
I've definitely achieved my goals. I'm working out with Matt for 2 years. My strength is better than it's ever been, and I'm 40 years old. My tennis game is better than it's ever been as well.
Like I mentioned before, we do a head-to-toe screening on the golfer. What I'm going to show you now is some coordination tests that we do. Like I said, golf is it's a very fine motor pattern that we need to do, and so there's certain elements of the torso and the pelvis that need to perform properly in the golf swing, and so we're going to test those. So we'll give you a little sampling of what we do in a coordination test. What I'm going to have you do is get into your golf posture first. There we go. And from here, I'm going to have him just try to move his torso without moving his hips. So I want you to kind of follow my lead. Golf posture here, and just move the upper body for me. Good. Go back and forth to the left and the right. As you can see there is that his pelvis is moving along with his torso. And I asked him to try to stabilize his pelvis. So go ahead and do that. Stabilize the pelvis. Keep going. He's having a tough time doing that. So now I need to figure out, is he got a limited mobility here, so this kind of goes along with it, or is he having a tough time stabilizing his hips in the golf swing? So what I'm going to do is going to come right around to the side. I'm going to block his hips here so they can't move now. Now I'm going to ask him to do the same thing, as far as you can to the left and as far as you can to the right. To the left and to the right. And I'm not sure if you can see it on the video there, but he was really good to the left, but onto his right he couldn't move too much on there. So he had a limited mobility of the torso turn on the right. So some things you might see on that is a limited backswing, and from there you might see a lot of other issues within the golf swing. So that's the torso rotation test. The next one we're going to do is the opposite, and this is the pelvic rotation test. We're going to get into the same golf posture here, and what I want you to do is just rotate the pelvis for me. Good. So now I'm asking him to rotate the pelvis without moving this. He's doing a good job not moving this, but he's not getting a lot of rotation in there. So I'm going to hold this here for me. Go ahead and rotate again, and go again. On that, we would like to see a little bit more pelvic rotation on that, usually about 45 degrees. That's what the golf swing requires. So he's a little bit limited on that. You can go ahead and rest. So on the two things there, just real quick on coordination and mobility, is that he's lacking a little bit of right turn in the upper torso, and he's also limited in his pelvic rotation. And with the golf swing, they have something that's called the X factor, and you need to be able to actually rotate that pelvis before the torso finishes his backswing. So he's going to have a tough time doing that in his golf swing, and you're going to see a lot of other compensations for that, as well as some possible low back issues because there's not a lot of mobility in that area. So those are a couple of the 29 tests that we actually do in our full screening to try to figure out some of the lumbopelvic issues that he might have.
At Florida Chiropractic and Sports Rehab, the dynamic approach to the rehabilitation of athletes and patients has brought me to do my exercises here, and has given me better endurance when I deal with patients in the office, in the operating room, and with my family.